I first came across it about 15 years ago as a social worker and a manager, and discovered it as a way of thinking and working with families and young people that made a much greater difference than anything that I was doing before. And it's really based on some very simple, deceptively simple principles about how all of us respond better when people work with us than when people do things to us or do things for us. So restorative practice for me is about working in ways that are characterised by being high support but equally high challenge. It's not a soft option for anybody. It's about how we enable people to effect change for themselves, whether in their personal lives, in their role as parents, as young people deciding to get involved or avoid getting involved in antisocial behaviour and crime, and for us in the workplace. It has just as greater resonance and potential value.
So I think it's something that we should perhaps be, getting those messages out more strongly. But the real impact is that the communities are feeling less crime and less antisocial behaviour as a result of the work that's being done with Family First. I'm very much aware that it's a model that not everybody understands. I think sometimes there's a concern that by taking a restorative approach, that you're somehow taking away the hard edge that comes with some of those crime and antisocial behaviour issues. But that's really not what it's about. The law is still there, and enforcement is still a key part of the process. It's what's often referred to, or at least is referred to sometimes locally, as high challenge, high support. Families need to understand what the consequences of their actions are. I mean, part of a restorative programme doesn't absolve you of those consequences. Policing will still enforce the law. But if we can work with families to understand the consequences better, to identify the causes of the antisocial behavioural crime they might be experiencing or involved in some way, and therefore help them not to get to the point where the law has to be enforced, then of course that's in their interest as well as that of the wider community. And really that's what's so fantastic about the restorative approach. We can intervene in a really meaningful way and prevent the necessity of moving to a stage of that hard edge enforcement, which is still there, if we get to that stage.
It really helps working in partnership with Berkshire Healthcare Foundation Trust and Wokingham Borough Council to deliver our strategic goals, which is very much about making the best opportunities for children and families, providing safe and accessible services. Some of these families find it really difficult to access healthcare. That may be for lots of different reasons. So working with Families First, it's very much about being there, actually providing the services for families where families are at, being an advocate for the families. And that's what we're committed to doing. So it achieves our strategic goals. Working in partnership is a great opportunity for our trust to develop an integrated way of working.
It would be fair to say that the outcome figures for changes for our families have just been extraordinary. They've been a lot higher than we'd expected them to be. In the first year, we identified very quickly that 77% of our families had reduced their offending very significantly, and actually the vast majority, all but one, had stopped. We thought, that's amazing. Is it because our cohort was fairly small at that stage, first year? Will we sustain that? And what we've seen in year two, as our figures tripled, numbers of families we work with have grown by threefold, is that 91% of our families have stopped offending, and all but two have stopped entirely, which is extraordinary. And some of those families, the police were with 2-3 times a week for over 2 years consistently, so it's a huge change. What's also struck us is that we've managed to engage over 2/3 of our young people in education to such an extent that they're there over 85% of the time. Their exclusions have reduced significantly. And this year that was a real challenge, because a lot of our children this year were children who were missing from education. They weren't in education at all. So the journey for them of reintegrating with just going to school, let alone being there 85% of the time, is huge. And the issues in their families that sit behind that, the level of need in their families, is really significant. So that's been a huge change for us. Lastly, I'd say kind of the model has been predicated on a sense of shared responsibility with those families and building a sense of hope and that change is possible. And in that context, we've looked at what is the hope of that individual and that household and that family, not what's our hope as professionals. And we hadn't expected to see 41% of our families in year 2 in employment. Many of those families have never worked. For some of those families, there's 3 generations of that household that have never worked. So that change is enormous. It's a really significant transformation in terms of just a level of confidence and aspiration and hope in those households. There's a lot behind the numbers that you don't see in terms of the journey of those families.
I think it would be make sure you're working together, that all the agencies working with a family are working together to understand the issues. And make sure that this is about families taking ownership for and understanding the potential consequences, whether those are consequences that might involve police enforcement or social care and intervention with their children. Make sure it is clear that there is an outcome to this if they don't make the progress that everybody is so keen to support them to make.
All our staff have now been trained for an inset day on restorative practice approaches. We've redone our whole behaviour procedure school just to focus around restorative practice. Something we saw was that, for example, in a class, a teacher might send a student out of the classroom, but nothing was done to bridge that gap between their relationship. So the student would come back into the classroom next lesson and display the same challenge of behaviour. So what we've done is we've restructured our whole behaviour procedure approach. So now, if a teacher sends a student out of a classroom, there has to be that contact between the teacher and the student, building on what happened in that classroom, how did it make the student feel, how did the teacher feel, so that next time the student comes into the classroom, there is that relationship built. Now, I was very sceptical at first as to how this would work, but it's had amazing results within the school. As a result, our incidents of behaviour have gone down, our internal exclusions have gone down, and initially the students found it quite difficult, but they're coming around to the idea now of actually building relationships with their teachers, and they very, very much enjoy that. It's also had an impact on break and lunch times around the school, and actually seeing the relationships between the teachers and the students is incredible, and it's as a result of this restorative practice approach.
I think we have robustly debated our approach to this programme. It's not easy. These families are very vulnerable. Their needs are complex. Many of our cohort have children who are subject to child protection plans, who are at risk of being accommodated, so removed from their families. The risks in those families are high. We need to get our approach right. What we've done is brought our partnership together to create a vision, one consistent way of working that's in the best interests of our families. So we have Thames Valley Police, we have Berkshire Healthcare Foundation Trust, both their physical health services and their emotional health support services working closely with us. We've got all of our children's services partners coming together in a way that I think it's fair to say we've not done before. We've never worked consistently together with a family, both in high challenge and in high support. I think the other big change for us is starting to have further conversations with adult services about actually could this be bigger than just the children's services agenda, and that commitment to work with us to create a wider vision for Wokingham as a borough. We're already seeing quite significant changes in the way we manage our criminal justice work around integrated offender management, antisocial behaviour management, working with whole streets, whole communities where the antisocial behaviour is between a whole range of households, and we know that if we don't work with 6 households at the same time, we'll never make the changes for the children in 1 or 2 of those households. That's innovative and it's unique. I've never seen that anywhere else in the country.
I can't question the results and the success that restorative practice has had. And my initial reaction to it, to Andrea, was good luck. I was very, very cynical of it. I spoke to my line manager about it at the time. We felt that there wasn't going to be much success with this young man. However, having seen the results of him, having worked with many families now, having seen the conflict resolution that's taken place between students within our school, there's no denying that this is an absolutely brilliant approach, and it's been very, very successful in our school. I'd say to anyone that was in the same position as me and cynical of this, that you've got to try it. You've got to see the results it achieves and how proud and rewarding it can be.
We're developing a pilot scheme whereby we hope to employ a practitioner to work in the Family First team. That will be a specialist health visitor school nurse practitioner who will bring all of their skills and sort of goals of making outcomes really, really important for children. We're very good at delivering services, but we want to really make a difference. So it's about really working with Wokingham Borough Council in whatever way we can find to deliver services, which is really about looking at actually what's worked well and what would be even better if, and asking the families themselves what they want. Restorative practice is all about working with families, not working and doing things to families or for families. And that's how our services should be designed and delivered.
We've seen the success that we can have in the Family First programme, and focusing on that principle that I was referring to before, about the high challenge, high support. This is not about removing the hard edge that comes with criminal justice enforcement. The police are there to keep people safe by enforcing the law. But equally, we're there to try to prevent crime and disorder in the first place. And I think there are areas outside the sort of Families First agenda that could really benefit from that sort of approach. And we can see parallels already. We're exploring areas like integrated offender management, where the whole purpose of that programme is to help people who we all understand have had a criminal past because they've been to prison. What we want is to help them come out of prison in a way that means they don't go on to offend again. Now, if the learning that we can take from the Families First programme can be applied in that sort of scenario, if people are willing to take ownership for their problems, understand the underlying causes and be supported to move forward in their life and not go on and commit crime, then that's a benefit to the whole of the community. Of course, if they do go on to commit crime, then there's always the enforcement that can come from the local police service.
From where I sit, the potential for restorative practice to start to transform our day-to-day practice in criminal justice, in children's services, in child protection and safeguarding arenas is enormous. There's a real opportunity to integrate what we do with one shared vision and one consistent approach. And for our families and for our communities, that would make a tremendous difference to them.
It has potential in any number of things we do internally, around how we manage complaints, around how we manage internal difficulties and grievances between our own people when things go off the rails. And I think in any number of other service areas it has potential. We use these models a lot in children's services, far less nationally and locally in relation to vulnerable adults. So I'm really interested in where there's greater potential to explore how families can come together and work differently with each other and with us as local authority and other agencies to find solutions for vulnerable adults in the way that increasingly we are with vulnerable children, as well, I think, as continuing to roll out what we're doing on the back of the Family First programme.